In 1854 London, a killer was moving through the city. Nobody could see it, nobody could hear it, but one doctor decided to track it like a detective. The killer was cholera, a deadly and invisible force. And in the crowded neighborhood of Soho, people were dying so quickly that fear spread through the streets. Families were terrified, doctors were confused, and almost everyone believed the same explanation. The disease was coming from the air. They called it bad air, poisonous air rising from filth, sewage, and rotting waste. In Victorian London, that explanation sounded believable. The city smelled terrible, the streets were dirty, the air felt heavy. So when people became sick, many thought the answer was obvious. The air itself was killing them. But one doctor did not accept the obvious answer. His name was John Snow, and instead of asking only, "What do people believe?" he asked a more powerful question. What does the evidence actually show? 1854, he solved cholera like a detective. By the middle of the 19th century, London was one of the largest cities in the world, but it was also overcrowded, dirty, and struggling to handle its own waste. Many homes did not have clean running water. Many families depended on public pumps. And in some places, sewage and drinking water were dangerously close to each other. Then cholera returned. The disease struck fast. A person could seem healthy one day and be gone soon after. To ordinary families, cholera felt like a curse. To many doctors, it seemed like a problem of the air. This was the dominant theory of the time, miasma theory. The idea was simple. Bad smells caused disease. If a neighborhood smelled rotten, polluted, or unclean, people believed the air itself could make them sick. And in 1854 London, that theory felt convincing. But John Snow noticed something that did not fit. If cholera came from the air, why did it not attack everyone in the same area equally? Why did one house lose several people, while another house nearby was almost untouched? Why did some escape, even though they breathed the same air? These questions bothered him, because to Snow, the deaths were not random. They were clues. John Snow did something unusual. He did not only stay in a clinic and treat patients. He went into the streets. He knocked on doors. He spoke with families. He collected names, addresses, and habits. Where did the victims live? When did they become sick? Where did they get their drinking water? Every answer mattered. To Snow, every death was not only a tragedy, it was also a piece of evidence. He was not looking for a smell. He was looking for a pattern. And soon, one place kept appearing again and again: Broad Street. At the center of the neighborhood stood a public water pump. People used it every day. They trusted it. They carried its water home to drink, cook, and survive. But Snow began to suspect that this ordinary pump was hiding something deadly. The killer was not in the air. The killer might be in the water. Then John Snow made the move that would change the history of medicine. He took a map of the neighborhood, and he began marking the deaths. One mark for one victim, then another, and another, and another. Slowly, the map began to reveal the truth. The deaths were not spread evenly across Soho. They clustered around the Broad Street pump. This was the breakthrough. Snow was not seeing bacteria under a microscope. He was seeing a pattern in human lives. The map became his crime scene. The victims became his evidence, and the pump became his prime suspect. But a good detective does not stop at one clue. Snow needed to test the idea. If the pump was the source, then people who did not drink from it should be safer. And that is exactly what he found. Near the outbreak area, there was a workhouse with hundreds of people inside. If poisonous air was killing the neighborhood, this building should have been hit hard. But it was not. Why? Because the workhouse had its own water supply. Then there was a brewery nearby. The workers were surrounded by the same London air. They were close to the outbreak, but many of them were spared. Why? Because they did not rely on the Broad Street pump in the same way. Many drank beer, and the brewery used a different water source. These were not small details. They were contradictions, and contradictions are powerful. They showed that the bad air theory could not explain everything. Not with a microscope, not with modern lab tests, not by seeing the germ itself, but with observation, comparison, and logic. The air was the same, but the water was different. That was the key. John Snow was building a case. To most people, the Broad Street pump was ordinary. It was part of daily life. People walked to it with buckets. Children passed it in the street. Families drank from it without fear. But Snow saw something different. He saw a possible murder weapon. The pump was not killing people by itself. But if its water had been contaminated, then every cup could carry the disease into someone's home. That was the terrifying truth. The danger was not something people smelled. It was something they trusted. Clean-looking water, ordinary water, Water from a pump they used every day. This was the real twist of the story. The killer did not look dangerous. It looked like survival. Jon Snow took his evidence to local officials. He argued that the Broad Street pump should no longer be used. The solution sounded almost too simple. Remove the pump handle. Stop people from drawing the water. And that is what happened. The handle was removed. One small action, one ordinary piece of metal, but it became one of the most famous symbols in the history of public health. Because the story was not only about one pump, it was about a new way of thinking. Snow had shown that disease could be investigated, not only feared, not only explained by tradition, but tracked, mapped, compared, and understood. Jon Snow was not just a doctor who solved a local mystery. He became one of the most important figures in the history of public health. At a time when most people believed cholera came from poisonous air, Snow used evidence, maps, interviews, and logic to show that the disease was spreading through contaminated water. He was one of the first people in history to demonstrate the transmission route of cholera with real-world data. And that point matters. He did not simply guess that water was involved. He built a case. He asked who drank from which source. He studied where deaths happened. He compared people who were exposed to the pump with people who were not. He looked for exceptions, and when the evidence pointed to water, he followed it, even when it challenged the strongest belief of his time. That is why his contribution was enormous. He helped show that infectious disease could be studied through patterns in a population. This became one of the foundations of modern epidemiology. Today, when experts investigate an outbreak, map cases, study exposure, compare groups, and trace the source, they are using the kind of thinking Jon Snow helped make famous. Before Jon Snow's work was fully accepted, many people focused on smells, air, and vague environmental explanations. But if cholera spread through contaminated water, then the solution changed completely. The answer was no longer just avoiding bad smells. The answer became prevention. Clean water, better sanitation, safer sewage systems, public health investigation, finding the source before more people died. This is why Snow's work became so important in infectious disease control. He helped humanity understand that disease does not move randomly. It follows routes, it follows systems, it follows human behavior. And if you can find the route, you can interrupt the spread. That idea changed medicine, it changed cities, and it changed public health forever. Jon Snow did not discover cholera bacteria. That came later, but he discovered something just as powerful. A way to follow the evidence before the invisible enemy could be seen. In 1854, London thought death was in the air. Jon Snow looked at the same city and asked a different question. Not, what does everyone believe? But, where are the deaths happening? Not, what explanation sounds obvious? But, what pattern does the evidence reveal? He never saw the killer. He did not have modern laboratory proof, but he found its path. And that is what makes this story unforgettable. Because sometimes science begins not with seeing the answer, but with noticing the pattern. In 1854 London, a killer was moving through the city. Nobody could see it. Nobody could hear it. But Jon Snow tracked it like a detective, and he found it in a water pump. Jon Snow did not simply remove a pump handle. He helped humanity learn how to follow a disease back to its source, and that is why his work became one of the foundations of modern epidemiology and infectious disease control. Thanks for watching. Be sure to like, subscribe, and ring the bell for more incredible stories from history.